Hi, this is our Ignite presentation for dysphagia, and our topic was Acquiring Dysphagia After a Stroke by Emily Cummins and Katie Gardner. So let's dive right in.
So the underlying condition of stroke is brain damage or dysfunction that occurs as a result of some disruption in the vascular supply to or of the brain.
So the first type of stroke is an ischemic stroke, which that is when blood arteries in the brain are narrow or they can also be blocked.
The second type of stroke is a hemorrhagic stroke, which is weakened blood vessels that rupture and bleed to surrounding areas in the brain.
So causes of dysphagia with stroke. So the first cause could be damage to the sensory regions, display issues associated with bolus retention and or clearance.
Another cause of dysphagia with stroke is damage to the premotor areas. They're likely to have difficulty with the imitation of the swallowing event or motor coordination of the event.
So need a dysphagia treatment with stroke. This could be due to incoordination of oral movements or also delayed initiation of the swallow and or swallow response.
A couple more needs of dysphagia treatment are increased oral and pharyngeal transit times, reduced pharyngeal clearance, resulting in multiple swallow attempts.
And some more needs of dysphagia treatment with stroke could also be penetration or aspiration of the bolus and an impaired pharyngoesophageal function.
Okay, so some types of dysphagia treatment for stroke. The first one is rehab or exercise. Some can compensate for impaired function, but actually intended to make lasting improvements in swallowing physiology.
So another type of dysphagia treatment for stroke is compensatory or postural, which compensates for the impaired function. So that could be breathing and swallowing coordination, airway protection, swallow response, or pharyngeal transit.
Another type of dysphagia treatment is sensory intervention, so compensatory in nature, thermal tactile stimulation, sour, cold and sour, and carbonation.
So another type of dysphagia treatment for stroke could also be novel interventions. So this would be things like e-stim and other things.
And these you can combine these treatment approaches. So for rehab and exercise treatment for stroke, a good candidate for this treatment are motivated patients who are cognitively intact to learn and implement swallowing strategies to make improvements in swallowing function.
So the progression of this treatment for dysphagia would teach the patient how to strengthen the oropharyngeal musculature involved in swallowing for the patient to compensate for that impaired function and swallowing physiology.
The expected outcome for a patient in rehab treatment is to have an effective and safe swallowing mechanism that allows the patient to maintain adequate nutritional intake and maximize airway protection.
So here's a video of the rehab and exercise dysphagia treatment for stroke. So in this video, this lady just shows multiple exercises that can be involved in this treatment.
The effectiveness of rehab treatment, the evidence from ASHA states that rehab exercise treatment for dysphagia individuals following a stroke event is effective rehabilitation oropharyngeal swallowing.
So from that ASHA article, it says that this treatment improves strength, skill, and endurance for compensation of impaired function and lasting improvements in swallowing physiology for adequate nutritional intake and airway protection.
And for the level of evidence, it's considered to have strong support for rehab treatment for dysphagia for individuals following a stroke.
And here are our references.